I'm Mark Freeman from Methodist Hospital, and I'm on your bargaining team.
I am Kamala Ramnath from North Memorial Hospital. I am on your bargaining team.
I'm Bree Bernini, and I'm from Methodist Hospital, and I'm on your bargaining team.
I'm Leanna Quant. I'm from St. John's Hospital, and I'm on your bargaining team.
I think we start very well of opening statement, and we come to find out from employer that does not like our proposal, or they don't like the questions that we ask them.
I spoke on behalf of health and safety, infectious diseases. I work with an employee that specifically, she had an infectious disease and she had to use her FMLA so that she didn't get in trouble. What I was trying to get at is that they want us to come to work even if we're sick. And that's putting patients in an unsafe position.
It's always an issue for our members whether or not to show up for work when they're sick or to use their sick leave. Under the understanding if they use their sick leave, they could enter into discipline. Is it right for our coworkers and our patients to have to be near a sick employee because they're worried about being disciplined? We brought this point forward to the employer. It was not met with anything but a deaf ear.
When the patient leaves the room, we have about 20 minutes to get up to the room to clean it. All the PPE will be gone, the signs on what the patient had, and the drawers with the isolation gowns, the hats, the gloves, everything will be gone. So no one knows what that patient had, and we'll go in with nothing on, clean the room, and next thing you know, when you come out and you're all done, you figure out that person had some type of illness, and now you're going home worried, thinking you're about to get sick too because the proper procedure wasn't done on that room.
We brought forward proposals to allow our members to have a voice in our health and safety at the workplace. We asked to be a part of a committee, to be forming a committee where SEIU concerns, our members' concerns of a workplace safety and health concerns would be voiced and heard by our employees, or our employers. We brought this forward, and the employer did not want to hear about them. They felt that they were adequately addressed in labor management committees. And there are no labor management committees active at this point at Methodist.
I know in the past of North Memorial, I tried myself with my employer to bring up labor management situation with the union, and we were all denied. We got shut down many, many times, and we continue on ask them, and they never want to listen what we have to say. But they do have a committee of listen to their own people, but not ours.
When we brought forth our concerns and our experiences of actual things that had happened on a health and safety concern by our members, the employers listened to us. They left the room and they came back and said, we are concerned, we did hear you, but we can't take any of this into account.
It was like a kick in the gut. They kind of just, I mean, I don't know, I was one of the ones that was talking, and then, you know, for them to come in, it just was like they didn't listen to our stories, or it's like our stories weren't real, or we were lying, or we were making them up. They weren't heartfelt. I mean, that's pretty much what he said. So it was a disappointment.
We have a program called All In. This program allows us, the union members, to continue to pay our dues even if the contract expires. We as union members are responsible for our dues. No matter if the employer takes it out of your check or not, we still have to pay our dues. The dues go for the support of our contract, your contract. We need to pay our dues so that the employer knows that we're all in together, and together we will get a good contract. Our next bargaining session is coming up in 2 weeks. We need to talk to each other to let everyone know that this is going on, and what is decided at this table affects all of us as members at our workplace. We need to support each other. We need to be supportive of our bargaining unit. We need to be supportive of our CAT team members, and we need to be, now more than ever, be supportive of each other as union members. This contract is your contract, and we are fighting for your contract. this isn't where the action takes place. The table is a long day where we discuss this. The real battle takes place in the workplace, where we as members need to stay together and we need to stay strong and supportive of each other and of our union. Because think about where we'd be without a union.
Everyone has a voice, and it's time to be heard. Since it's time for the contract, there's no reason to be scared. It's time for everyone to come together and speak up.